I couldn't think of a better person for the Coulter Award than Rainer Storb.
Rainer's work has shaped the field in many ways.
Making marrow transplantation more successful, more available, more effective, less toxic.
My dad was a physician, my grandfather was a physician, and I decided to study medicine. And in the course of my medical studies, I encountered a bunch of very impressive hematologists, which made me go into the field of hematology. I was in Marcel Bess's laboratory in Paris, but I felt I was getting more and more removed from the clinic. And since the laboratory had many visitors coming, I kept asking, is there a way of combining lab work with the clinic? And one of them said, there's another guy who just moved to Seattle, Donnall Thomas.
Rainer joined Don in 1965 and was a key member of the transplant team.
Donnall Thomas was this amazing pioneer, and Rainer was right at his side in the very beginning days of bone marrow transplantation.
And it was Rainer's work, along with Bob Epstein, that developed histocompatibility typing sera that allowed them to pick litter mates that were matched, and every one of them turned out to be long-term healthy chimeras.
By the end of 4 years, Don then persuaded the public health hospital to allow us to convert an abandoned obstetrics ward into a small transplant unit.
The first patients with leukemia who were cured with transplantation, at the time there were just a handful of patients. It's estimated this year that there will be over 100,000 people worldwide that will get a transplant. And if you look at the cumulative number, now it's upwards of 2 million people. When we first started doing transplants here in Seattle, we were using single-agent methotrexate to prevent graft-versus-host disease. Since then, Rainer's made graft-versus-host disease less and less of a problem, making cure rates higher and higher.
Rainer very quickly also realized there was another effect, which we call graft-versus-leukemia. The immune system from the donor, of course, attacked the host, but that immune system also attacked the leukemia.
The idea of the mini-transplant came to me because of this early finding. And I said, if we could get transplants on board somehow without killing the patient, maybe this graft-versus-leukemia effect can be used to keep the relapse rate low.
It opened up transplant to older patients, those with comorbidities that we really couldn't treat. And it's just very gratifying to see the difference. Rainer is definitely a person who leads by example.
In addition to the more than 160 personal mentees in my laboratory, we had hundreds of physicians from all over the world coming for 6 months to 2 years to learn about transplantation.
He knows that the currency of the future is the trainees. If you can't pass it along, then science won't continue to move forward.
He has an incredible work ethic. He's very, very disciplined, and he has the best interests of everyone at heart.
Rainer believes in physical activity to clear the mind, and I think that was really important.
I started rowing because we live on Lake Washington, and I fell in love with it. It just clears my mind to really be ready to treat patients.
He cares deeply about patients, and he really wants to make a difference.
The ability to go from the lab into the clinic and deal with patients, that to me was the most important thing.
He's very good at breaking it down to the basic concepts. But more importantly, he also listened to the patient.
I was diagnosed with a form of leukemia called chronic myelogenous leukemia in my mid-30s. So I went to my hematologist, who had recommended me to a hospital in New York, and I said, I really think I need to go to Seattle to see Dr. Storb. And I just had this feeling, this is the one who's going to save my life. And I will always be grateful for the extra years that I got.
Wallace Coulter has made an incredible impression on me.
The Coulter counter was like opening a book and being able to read something that you couldn't read before.
Rainer Storb is highly deserving of the Wallace H. Coulter Award for Lifetime Achievement in Hematology. He was so passionate and enthusiastic about bone marrow transplantation and how it could help people and patients.
And he's also a great human being, and I think it would be hard to find anybody in cancer care and research who had achieved more than he had in terms of delivering an amazing treatment, amazing outcomes for patients.
I feel grateful and honored to receive the Wallace Coulter Lifetime Achievement Award, especially since the American Society of Hematology since 1969 has been closest to my heart. I just feel honored that the Society deems me worthy of this incredible award.